This station is designed to test your ability to perform a patient assessment of a victim of a multi-systems trauma and voice treat all conditions and injuries discovered. You must conduct your assessment as you would in the field, including communicating with your patient. You may remove the patient's clothing down to shorts or swimsuit if you feel it is necessary. As you conduct your assessment, you should state everything you are assessing. Clinical information not obtainable by visual or physical inspection will be given to you after you demonstrate how you would normally gain that information. You may assume you have 2 EMTs working with you and that they are correctly carrying out the verbal treatments you indicate. You have 10 minutes to complete this station. Do you have any questions? And my answer is no. So would you actually be the evaluator for me, okay? All right. So I get a scenario of a guy whose propane tank blew up. Okay, BSI, is my scene safe? All right, I'm going to approach my patient. As I approach my patient, I'm going to be considering that I have one patient. My mechanism of injury is an explosion. I'm going to place ALS on standby, and I am going to take C-spine stabilization. Hey, are you okay? I'm pinching the earlobe. That'd be you, Drew. Okay, patient moans. I'm going to open the airway with a jaw thrust. Look, listen, and feel. What is my respiratory rate and quality?
Respirations are 6 and gurgling.
6 and gurgling. At this point in time, I'll have my professional partner administer suction to remove the fluids. What is my respirations now?
Respirations are 6.
6? Okay, I'm going to place an oropharyngeal have my partner place an oropharyngeal airway and begin ventilating the patient with 15 liters of oxygen and a bag valve mask at a rate of 1 breath every 5 to 6 seconds.
Consider done.
Okay, I'm going to turn over airway and C-spine to my professional partner.
Okay.
Okay, at this point in time, I'm going to expose the chest, looking for breathing difficulties. I see a wound. Do I hear sucking sounds and gurgling?
You do see some frothy blood there.
Okay, I'm going to cover it with a gloved hand. I'm going to take my occlusive dressing. I'm going to apply the occlusive dressing and tape it on 3 sides. Do I see paradoxical motion?
You do not see any other injuries or motion.
Okay.
Equal follow rather than follow chest.
Okay, thank you. I'm going to check my pulses, carotid and radial.
Radial is absent, carotid is rapid at 136.
Noted. Skin color, temperature, and condition.
Your patient is cool, pale, and clammy.
All right, noted. I'm going to begin to expose my patient while doing a blood sweep. I have a wound on the arm right here.
You have some oozing blood there.
Noted. And the hand is actually there.
Yes. The hand is actually there.
Okay. I'm going to expose the leg. I see.
You have an exposed bone with bright red spurting blood.
I'm going to apply a tourniquet to control bleeding above the site, but below the joint. Is the bleeding controlled?
It is.
Thank you. I also note that there's a bruise there, but I'll worry about that later. All right. I'm also going to check further down the leg to make sure I don't have any bleeding there. I see a wound here.
It's just dark and oozing.
Noted. Okay, at this point in time, I have determined that this is a high priority patient. I'm going to send my partner to get the long spine board, C-collar, stretcher, while I prepare the patient for transport, and I get a rapid trauma assessment, doing a rapid head-to-toe, looking for any life threats that I might have missed. Does anybody know this guy?
No.
Can I get a sample history?
And there was no other life threats found.
Thank you. Pulse rate and quality?
Radial is absent. Rapid 134 at the carotid.
Noted. Respiratory effort is still 6. I'm asking.
6 being assisted by your partner.
Being assisted by ventilations. Thank you. Do I have any crepitus in this arm since I had a wound?
Your blood pressure is 80/60.
Noted. My patient is definitely in shock, so I've already laid him flat. I've already got him on oxygen. Is my partner arrived yet with the long spine board?
Yes.
Okay, we're going to apply a C-collar. We're going to log roll the patient on the count of 3. 1, 2, 3. Checking the back. No other wounds noted. 1, 2, 3, back onto the board. Secure the patient to the board, nipple, navel, knees, head. Cover the patient with a blanket to treat for shock. load the patient into the ambulance, and we are now en route to the closest appropriate facility. At this point in time, I will begin my detailed assessment, beginning with the head, checking the scalp, the head for any decap BTLS,
Nothing noted.
checking the eyes for pearl,
Pupils are equal but sluggish.
noted, nose for any drainage,
No drainage.
mouth for any fluids, broken teeth, anything that might interfere with the airway, checking behind the ears for battle sign, okay, checking the trachea for see if it's midline,
Trachea's midline.
Okay.
No drainage from the ears. No vital signs.
thank you, checking for jugular vein distension,
Veins are flat.
noted, checking the back of the neck for step off,
Nothing noted.
okay, palpating the shoulders and clavicles,
It's
ribs
on the side of the injury.
on this side,
Yes.
noted, okay, listening for breath sounds.
Breath sounds are equal bilateral.
All right, good. Palpating the abdomen,
Abdomen is rigid, non-distended.
noted. Pelvis,
Pelvis is stable.
sweep for priapism.
None noted.
I know that I have a fracture here since I have bone sticking out, so I'm going to split this to the board. Do I have checking the knee?
Stable. Stable. You have some grippers in the lower leg.
Strap it to the board. Splint it to the board.
Pulses are absent.
Can you feel that? Can you wiggle your toes?
No response.
Checking this arm.
Stable.
Okay, and this arm.
Stable.
Checking pulses.
Absent.
Can you feel this? Can you wiggle your fingers?
No response.
Okay, I would now secure any other wounds that I had. I would place gauze and bandage that wound here, gauze and bandage on the wound here. At this point in time, I would begin my ongoing assessment. I'll recheck my ABCs, I'll recheck my interventions, I'll recheck my vital signs, and I'll recheck my detailed, and I am done with this station.